Okay. Dr. Mazzola, can you tell me about craniosynostosis?
I think one of the most important things when you're picking a surgeon or picking a craniofacial team to do your child's craniofacial surgery is that you feel comfortable with the surgeon and the institution or hospital where you're having a procedure done. It's very important to meet with the surgical team beforehand to ask appropriate questions. Very often what I'll ask my patients to do is to see me the day before the surgery or a week before the surgery with a list of questions. We go over everything, all the questions that they have about the procedure. We talk about what's going to happen the day of the surgery, what time they should bring their child to the holding area, who will go into the OR, will it be one parent coming into the OR, and what will happen in the OR, who will be in the room during the surgery, who's doing the surgery. I think many parents assume that the primary surgeon that you're meeting does the whole surgery by themselves, when actually it's usually a team of people in the OR. There are pediatric anesthesiologists, pediatric OR nurses, the pediatric neurosurgeon, the pediatric craniofacial surgeon, or oral maxillofacial surgeon. And one of the things we always talk about preoperatively is what is the postoperative care of your child. So very often after the surgery, I bring the child with the pediatric anesthesiologist up to the pediatric ICU. I let the parents know that this is part of the routine. The child's not critically ill, but right after surgery, I feel that it's important to be in the pediatric ICU, to have that level of critical care nursing available, to have the monitoring available for pain control and for the best quality care for the child. We talk about the postoperative care once the child leaves the pediatric ICU. Sometimes children will stay 1 day after surgery, sometimes they have to stay 2 days after surgery. We talk about the IVs, we talk about following hemoglobin after the surgery, the possibility that the child may need a transfusion after surgery. After discharge, I usually have the baby seen by the plastic or craniofacial surgeon the week after surgery, and then I see the baby 2 weeks after surgery. Usually we use absorbable sutures and cover the incision with Dermabond. Dermabond looks exactly like clear nail polish, and it helps to prevent infections, protect the incision, and it allows me as a surgeon to get a clear view of what the incision looks like. So I think it's very important for the parents to think about these things when you're picking your craniofacial team.
What is unique about the patient that you're working with today?
The baby that we're operating on today was actually seen by a local craniofacial team, and they're an excellent team. They had offered the parents surgery where they would basically make an incision from ear to ear. This is called a bicoronal incision, and reconstruct the baby's forehead for metopic synostosis. Metopic synostosis is a condition where the two frontal bones grow together and fuse prematurely. This process usually starts in utero. The babies then develop a very triangular shaped forehead. In the past, the only surgical treatment was to do a bicoronal incision, reconstruct the baby's forehead and orbital rims. However, about 8 years ago, David Jimenez, who's in Texas, developed a procedure together with his wife, who is a craniofacial plastic surgeon. Her name is Constance Barone. They developed this procedure where the incision was very, very small, actually 1 or 2 centimeters small, and then going underneath the skin with an endoscope, which is a small camera, almost like a pen light, the suture that was fused would be removed endoscopically, and then the baby would have a helmet placed on their head, which would actually reshape the forehead over a long period of time, over 6 to 12 months in some cases. The advantage of doing this limited surgery is that there are less risks involved during the surgery. There's a lower chance of significant blood loss. The length of stay in the hospital and in the pediatric ICU is significantly reduced. And the child cosmetically does much better in the sense that they don't have a large incision on their head. So endoscopic surgery is an important option for parents and children to consider if they need craniofacial surgery.